Hey everybody, this is Professor Beth RN from nursing.com, and today I'm here to help you break down, understand, and strategize answering next-gen questions. While nursing school gives you a solid knowledge base, clinical judgment makes you the safe new RN when you're caring for patients. I'm here to help put your mind at ease with these unfamiliar question types so you can pass that NCLEX and ultimately start your dream career. Let's get started. Okay, so how do you know this is a drag and drop question? So these questions will give you several options to drag to complete sentences after reading a case scenario or maybe EHR. Kind of like fill in the blank, but with options. All right, and there's two different kinds of ways this can be presented. There is drag and drop close. So with drag and drop close, you're looking at a paragraph of up to 5 sentences. There'll be one fill in the blank area for each sentence. And you'll have an option of 4 to 10 words that you could drag down to complete that sentence. Or you could see a drag and drop rationale. So you can see one sentence that needs 2 to 3 words that need dragged for that fill in the blank area. So this is a great example of a drag and drop rationale, right? So the client is at risk for developing blank, blank, blank. In every single one of these words, with my mouse, I could hover over, click and drag. I'm randomly pointing arrows, so probably not correct answers, but that's how you would maneuver this type of question. Now, strategy. This question can hit any part of clinical judgment model. So your best strategy here is clinical judgment model. Step 1 is you're going to recognize cues. What are cues? Cues are going to be symptoms, things from the chart, labs. So we're going to toggle through every single EHR tab. We're going to leave no leaf unturned, okay? Let's look at one of these together. Okay, here we are at nursing.com, and I see that I have a drag and drop question. So drag and drop close. I have a whole EHR here, so it's time to toggle. Let's look through every tab, find those cues that correlate to our answers. Now, we're not going to panic if we don't see every answer identified in every tab. Let's go. Let's get this done. So first tab of my EHR, patient description. What am I looking for? Things that are abnormal. As I'm looking through this, I am reading things like increased work of breathing and pale skin. All right. So I noticed that that is definitely abnormal. Increased shortness of breath and fatigue for the last 2 months. That is abnormal. Let's look at the next nursing note, the next tab. All right, so there's a lot of words here, but what am I looking for? I'm looking for what's abnormal. So as I'm reading through the 1210 nursing note, I can see that my patient has pale skin and he's diaphoretic. He's gained 3 pounds without having any diet changes. He doesn't feel like he has an appetite. His shoes are tight. His socks are leaving indentations. So on his ankles, lots of things here. 1215. A focused assessment was done. Looks like he is still short of breath and he's using accessory muscles. He has crackles. He has a cough. He has S1 and S2 and S3. I don't like that. Sounds like fluid overload. He has 2+ pitting edema. Okay. So before he just had indentations on his socks. Now he has 2+. All right. So he's not getting better, right? This patient is trending worse. Right, it looks like he's going to get some oxygen. He has an 18 gauge IV put in. He has a chest x-ray done. He has all different kinds of labs done. He has different blood work done. It is 105. He is anxious. He has an increased shortness of breath. He's now in a non-rebreather. This patient is worse. He is now coughing up pink, frothy sputum. That should be a big clue for you guys, okay? So it looks like labs and diagnostic results are posted. Let's go over toggle every tab. So labs, I'm looking for what's abnormal. And when I'm thinking about fluid overload, I really like to check a couple things here. So I see his troponins normal, so not a heart attack there. But his BNP is sky high, guys. So a BNP, it should be under 100. Okay, this guy is 15 times normal. All right, that should help you out. Imaging results. His chest x-ray, he is full of fluid. He has pleural effusions, ton of fluid. He has an ejection fraction of 35%. You should recall that a normal ejection fraction is around 55%. So he has a weak pump, right? A weak pump. Flow sheet. Let's look at his vitals. Oxygen is definitely decreasing from 90 to 88 to 85. Okay, his temperature came down. That's nice. But look at those respers. 29, 32, 42. Okay, so let's look at this question. The nurse is hypothesizing which condition the client is experiencing. Drag the word choices to complete the sentence. All right, so I think my patient probably has pulmonary edema. Get that guy over there. And what was caused by that? Probably not an embolism. We didn't talk anything about having a DVT in the leg, nothing there. We looked at the troponin. Myocardial infarction's probably not it. And if you remember, WBCs were normal. So I don't expect pneumonia. Let's try congestive heart failure because of that BNP. Hopefully you can drag a little more savvy than I can. Let's get that in there. There we go. And submit. Boom. There we go. 2 out of 2 are right. Here's your rationale. Nursing.com will always give you rationales. It's so important to know why the correct answer is correct and why the wrong answer is wrong. Drag and drop questions. How are these questions scored? They could be scored in 2 different ways. So you have your drag and drop closed. We just looked at one of those. So if you're dragging answers to a group of several questions using that 0-1 scoring rule, it means you're going to get a point every time you get one correct. So the sum of your correct points. Drag and drop rationales. Those are going to work by you'll get a point for every correct answer, but an incorrect answer will subtract from that total. Okay, partial credit questions were always my favorite in nursing school. We like partial credit. So again, just to review, how are we answering? Well, we're going to answer drag and drop questions. We're going to drag answers that are relevant, and we're going to drop them into a statement sentence according to some kind of scenario. Okay, so what's going to help us is we have to carefully review all of the information provided. Is it a scenario? Read it thoroughly. It's an EHR, toggle every single tab. Don't miss anything. Clinical judgment, well, it can hit so many parts. So let's start with recognizing cues, right? Go through those tabs and ask yourself, what is abnormal? That is what's going to help you on every single tab. Good job, guys. You guys got this. Apply your nursing knowledge to these question item types. Use the tips and tricks we discussed, and I'll help you answer your NCLEX questions accurately. Before you know it, you'll be celebrating passing all your tests, including your NCLEX. I can't wait to celebrate with you guys. If you want to learn more, come see us at nursing.com. We have more questions and practice for you. All right. And as always, happy nursing.